candidate for dental implants. He was a great patient, and when he told me that he didn't want to have dentures, he wanted to have his own teeth, so he doesn't have to deal with the embarrassment and all the problems with his teeth. So he told me, there is no way I'm going to have denture, I want to have dental implants. So he was a perfect candidate for dental implants. He's been an excellent patient, and I was so happy to see the great results we accomplished for him. It was a great success, and he enjoys now eating any food he wants and smiling, and nobody knows he has implants, and he's happy. He forgets probably that he has them there. It's like his own teeth.
Well, my adventure with Dr. Nicholas began actually in Mexico. I was seeing a dentist down there, and he noticed I had a lot of bone recision. And he showed me the x-rays, described exactly what was wrong, and said, you need to see a periodontist. I could have done it in Mexico, but for major surgery, I wanted to be closer to home. So I went to the Yellow Pages. I found Dr. Nicholas, looked her up, and she repeated exactly what the Tijuana doctor had said. So I had two dentists say the same thing. I chose to go with the procedure. And I had, first of all, bone graft to build up the bone. And then 5 teeth had to be removed. 2 were under caps and had been cracked. Dr. Nicholas called that a time bomb. She was really upset when she saw that. And also had 1 sinus lift on one side. That was to get the sinus gland higher up so they could put the implants in. And 2 were on one side of my mouth and 2 were on the other side. So we had 6 months apart. And it was a sort of a breeze, actually. I had very little pain. I've been going to dentists all my life, and this was just a piece of cake. I did have pain pills to take. The doctor prescribed them, but I only take 1 a night to get a good night's sleep. Otherwise, I never took any pain medication.
One of the common misconceptions about dental implants is that they are painful.
I can give you chapter and verse on that because I have a good buddy. We're actually high school mates. He also lives in the desert, and he needs a lot of periodontal work, and he's afraid of the pain, the big baby. And Dr. Nicholas and I have a campaign to get him into the chair because he really, really needs it, and he just keeps going, I don't want to be hurt, I don't want to be hurt. And I keep saying, there's no pain. And she keeps saying, I'll take care of the pain. Don't worry about it. So I think we have finally got him convinced that he's coming in next month to get the full treatment.
Common misconceptions about dental implants with Dr. Nicholas.
There are many patients, people in the desert that are in Zelma's age, and they don't think that they're good candidates for dental implants, and they are reluctant, and they think that implants are only for younger people. And Zelma is a perfect example of that. She was an excellent candidate for implants, and she enjoys the fact that she can eat again and all the benefits that implants have to offer.
A number of years ago, I was living in Colorado, and I went to a periodontist to see about having some dental work done and asked him about implants, and he said that he didn't think I had enough bone to do implants. So I just gave up on that. Then when I moved out here to the desert, I began to have some problems, and the Eisenhower Medical Hospital over there, they gave me Dr. Nicholas's name, so I came to her, and I'm so glad I did because she did a beautiful job. I didn't have any problems getting through it. So then the next thing that happened, a friend of my son's was having very bad problems with his teeth, and his mother knew I'd gone to Dr. Nicholas, and she called and asked me what I thought. I said, absolutely, have him go to Dr. Nicholas. So he came. Then just recently my son moved out here to live with me, and he had a big problem. And so I sent him to Dr. Nicholas, and he's been fixed up, and he's in great shape now. And I was told about Dr. Nicholas, came to her, and made my day, made my year. Well, I talk to a lot of people about this because when I find something that works for somebody my age, which is almost 83, I think that I always pass the word if something's good or bad. If I don't like work people have done for me, I tell people about it. And if I like the work they've done, I tell that. And We all just think Dr. Nicholas is top around here. She does what she promises. Well, I think everybody ought to get a second opinion if they feel they need something. If they don't get it from one person, they need to go one doctor, they need to go to another one and find out, because this is a serious thing, and I was not going to have dentures. If I live to be 105, I'm not going to have dentures. She was humming and making a little music, and the whole thing was just really a piece of cake. I didn't think it would be that easy to get through.
I wish all my patients were like Wally. Wally's a nice, funny guy, and we had a great time each time he came here. It's like you forget that you're working, and it was great when patients have great personality and they make jokes and they make everything sound so fun.
How predictable is dental implant surgery?
Patients don't realize how predictable dental implants really are. The success rate is 96 to 98%, the highest success rate of any surgery on a human body. And today, with all the advanced and improved surgical techniques and new implant technology, it's the most predictable surgery one can think of.
The dentist said, "You've got to see Dr. Nicholas." And I said, well, what's going on? What am I going to have done? And he said, well, I think you're going to have some periodontal work done. And he said, because this could happen in other areas in your mouth as well. And he said, and you've got to have that taken care of. So I came over to see Dr. Nicholas, and I was very glad that she was a lady, because I kind of like ladies. And I found Dr. Nicholas and I got along very well. And she said, well, I'm going to have to do quite a bit on you. I'm going to have to do the periodontal work. And she said, I think you need 2 implants. So we made an appointment, and we set up, this was all a couple of years ago, we set up appointments, and we went from there. 0 pain. She gave me some pain medication, and I went and I had the prescription filled, because I figured it would bother me that night. And I think it was a couple of years ago, and I think the bottle of pain pills is still there, because I never had to take one of them, even though she pulled 2 teeth, and she did a lot of gum surgery on me, and never any pain at all. This all took place over about 1.5 years, and I got to know everybody in here, and I liked them all. And I liked Dr. Nicholas and her assistant so well that I was actually sorry when it ended. I mean, I really missed coming in here, because it was like I had some new friends. I think she's the best in the business. Of course, I only know one, but my dentist told me she was the best in the business. And I would come in here, and Marlene, who was her assistant, would have some rock music or some big band music. And Dr. Nicholas, when she came in, Marlene switched it over to the salsa music, and she'd kind of sing and hum while she was working on me. And it was really neat, because it took my mind off things. And I liked the music. It was much better than the usual music you get in dentist's office.
Fact. More and more dentists are referring their dental implant patients to Dr. Nicholas.
I have 4 dental implants. I was referred by my dentist to Dr. Nicholas. I had some bone loss, and my back teeth were coming loose. And he said if I wanted to save my teeth, I should see Dr. Nicholas, because she could probably save most of them. And she did. I didn't want to have dentures at all. My mother had them at a very young age. Of course, she thought there was nothing like them. And I had a brother who's a year older and a sister who's 10 years younger who had dentures at a very young age. And of course, they never complained about them, but I just didn't think I wanted them. And my dad had dentures, and he hated his. And he found them very difficult to wear. And I said, well, I'm never, ever, ever going to have dentures if I can avoid it.
Question. Can you have osteoporosis and still get dental implants?
Okay, I have osteoporosis, and I was losing bone in my jaws, and my teeth were coming loose. So when I came to see Dr. Nicholas, she said that she could do some bone grafts and replace the bone that I had lost. And we used my own bone, because she said that was preferable to using cadaver bone, because there was less chance of rejection of the bone. After the implants, I was able to eat some of the things that I had avoided when I was missing my 4 teeth, especially things like apples and nuts, because they always wanted to go where there were no teeth. And now I can eat anything, everything, and it's wonderful.
Question: what about pain?
There really was no pain involved. It was a little bit uncomfortable holding your mouth open long enough to get everything done, but other than that, there was no real pain. She has music playing the whole time. She often sings along with it, and just really very, very nice person. And she's very concerned with whether or not anything is hurting so that she can give you more Novocaine if it's needed. It's just great.
Many patients are told that they are not candidates for dental implants.
So he said, I suggest you go into LA because there isn't anyone out here that would be able to take care of you. Well, I don't drive that much. I don't care to drive on freeways. So I said that was unacceptable. So I started looking around. And I opened the phone book and I saw, oh, a lady. By that time I was really tired of having male dentists tell me all this. I'd been in a dentist chair most of my life because I started out with braces when I was about 10 years old, and from there it got progressively worse. So I came in and talked to Dr. Nicholas, and she explained everything very thoroughly, which is what I needed to know. And I had lost a lot of my jaw, and she was going to have to reconstruct all of that. So I said, fine, let's go ahead with it. So she did a beautiful job, and I'm so pleased that I found her. I had a total of 13 implants. These are so natural you don't even know they're not your own. You don't feel any difference. And, you know, that's the first thing people ask me, well, doesn't it feel funny? I said, no, it feels just like my own teeth. What Dr. Nicholas did was actually give me a root structure. Pain was not an issue, because I had a local anesthesia, and plus she played my favorite singer when I was being worked on, and there were some days when I was in the chair, well, the longest time was almost 7 hours.
What are patients saying about Dr. Nicholas?
Very feeling, and that's what I liked. That most people have such a fear of their dentist anyway. I didn't have a fear of dentists because I've been in a dentist chair so much in my lifetime, but Dr. Nicholas has got a very nice way about her. And all of her staff the same way. They treated me just beautifully. So I would really like anyone that has any big problems like I did to give her a call. All I can say is that I've had absolutely no problem afterwards. None. Brush your teeth the same way. You can chew everything. I guess I just tend not to want to bite into anything real hard, like apples or whatever, but I think you could, but I just am cautious. They look better than what I had.
Well, I not only went to a lot of dentists, but I went to dentists in 2 different states, in Florida as well as in California. Every dentist I went to said it was just impossible to put implants in my mouth because I lacked all the bone that was necessary. And it wasn't until I was referred to by a friend of a friend to see Dr. Nicholas that she gave me the first encouragement that I'd ever had. And thanks to her and 11 implants, I can now laugh out loud, and I can eat everything that I want to eat. I can crack nuts in my mouth if I like. Well, as far as pain is concerned, I must say that Dr. Nicholas was concerned about me to the point where when I was home in the evening, she called to find out how I was doing. And I think she was always surprised that I may have taken one painkiller or none at all. She had given me Vicodin just in case I was uncomfortable, and I seldom had to use it. And when you think of the end result, I think I would have completely forgotten the pain anyway. I work in real estate, so I'm with the public all the time. And it gives me so much more confidence to look at people in the face knowing that they're looking at my mouth, and if I'm laughing, I don't have all that void and empty space in the background. I feel so much better, so full of myself having all these nice new teeth. And as far as eating is concerned, I can eat anything now. I have great chewing power, and when I'm dining out with friends or relatives, I don't have to avoid eating different things. I can just eat just like everybody else does. Well, my biggest problem was that I did not have any bone, and that's why I was rejected by all these doctors. Dr. Nicholas is the one who augmented the bone by giving me all the bone grafts and the membrane grafts so that I could have this surgery. What a wonderful thing it is to have these implants. And the fact that Dr. Nicholas was able to give me all this bone augmentation and finish off having all these wonderful teeth is so wonderful. And I'm so happy that I can publicly thank her. Dr. Nicholas is just full of life. And even though she's doing every surgery in your mouth, she likes to listen to salsa music, which I enjoyed myself since I have a Spanish background. And she'd be singing and dancing and just so thrilled and happy all the time that it was very nice. So you don't get that, oh, I'm so frightened, scared feeling, because you're relaxed, because the dentist is relaxed.
Patients have different age. Some of them are young, some of them are in their 80s. They come for different reasons. Some of them miss one tooth or two teeth. Some of them have a full denture, and they need the denture to be supported to have more retention, and they require 2 to 4 implants to make the denture more stable. So while they eat, that doesn't move around. And some patients, they have a bridge that was loose and it's failing, and they didn't want to have a denture, and they end up needing to have dental implants. So there isn't a particular prototype of patients. Dental implants can last as long as a natural tooth. Some people have their teeth for the rest of their life, and so are implants. The benefits part of the implants is they won't need a root canal, and they don't get cavities. And implants are a perfect solution for that. A lot of dentistry is patchwork with bridges and dentures, and today with dental implants we're able to give their tooth back. My oldest patient was 91 years old, and her daughter, that was probably in its 60s, came with her for treatment. She didn't hear very well, so she needed the daughter to translate. And she was a wonderful lady. She insisted that she didn't want to have a denture. And she said that she will do whatever it takes to have her keep her teeth, because her relatives and her sister had dentures, and she doesn't want to even go there. Anybody that has osteoporosis can have dental implants, because dental implants preserve the bone and maintain the density of the bone. There is a misconception that osteoporosis, when you have osteoporosis, you cannot have dental implants. Patients that have osteoporosis, their jaw breaks because of lost bone. And they're afraid that the implants are not a solution for them, and it's quite the opposite, because implants increase the density of the bone. There are many studies that showed that the density of the bone is increased by placing dental implants. Many patients are afraid of pain, and some of them, because of that, they don't want to have any kind of dentistry. And I offer my patients different solutions for that. They can today have their implant treatment while they're asleep, totally relaxed and comfortable, and as just a breathe. There is some discomfort a couple of days after the surgery, but they all tell me, I'm surprised when I call them at night to see how they're doing. They told me that they didn't even take a pain pill. People that have full lower dentures think that dental implants are only to replace the whole mouth, would have 12 implants in order to replace the lower denture. And there is a misconception that if you have implants, then you don't need a denture. Well, with only 2 to 4 implants, you can dramatically increase the benefits, the support of the denture, how it functions, and it moves less in the mouth, and it's great. In some cases, only 2 implants are sufficient to anchor the denture to the jawbone and make it very stable and strengthen its ability so that it won't have less movement when they eat, and they can chew again. And with 4 to 6 implants, you have even more retention, and it improves and strengthens the denture even more. Once you have 6 to 8 implants, then you can eliminate completely a removable denture. You can connect the teeth with the implants with partials like teeth, and have a fixed, non-removable. Many patients want to be asleep during the procedure because they feel there is no other way they're going to be in a dental chair. So there is a solution for that. Sometimes we sedate them with IV sedation. Many patients today choose to take pills. We can give them pills so they don't have to deal with a needle from the IV sedation, and they're completely relaxed, they're sleepy, and when the procedure is over and in the evening I call them to see how they're doing, they don't even remember what went on, what they said, what they asked. When somebody is missing teeth in the front area, in the aesthetic zone, the front teeth, and they lose those teeth due to trauma, or they have a replacement with a crown and they don't like the way they look, dental implants look exactly like the natural tooth. You cannot distinguish. I can show you lots of pictures that you cannot see a difference between a tooth and an implant. When you smile, people can smile with confidence and nobody will know. After receiving my dental degree, I continued at Loma Linda University hospital residency in periodontics and dental implant. And as part of my residency, in order to graduate, I had to place a number of implants. I feel very fortunate that I had the opportunity to have implants as part of my university training rather than placing dental implants in a course, a 2-day course on placing implants on plastic jaws. And as part of my training, I was trained with the newest technology and procedures in regenerating bone around teeth and implants. And a periodontist is a dentist that is trained to save teeth. And we try to rebuild bone around teeth. And when we cannot save the teeth, then we replace the missing teeth with implants. I've been in private practice for over 10 years now. I have a practice in Palm Springs and a practice in Palm Desert. And those practices are the way I dreamed my office to be, to have a friendly environment and a warm environment for the patient to feel comfortable and not to be like the way dental offices used to be that smell like dentistry. And so this way patients feel comfortable and we have a very good friendly relationship. In over 10 years that I practice in private practice, I placed over 1,000 implants, and that gives me also the confidence that I can do an excellent job, and I have a lot of pride in my work. And every year I go to a lot of continuing education classes. I'm a member of a different professional organization, and this August I've been to a meeting in Montreal that we discuss how to handle difficult cases related to implants. It was the International Congress of Oral Implantology. This last September I've been to the annual meeting of the American Academy of Periodontology. So I like to learn what's my colleagues, the newest techniques that came up to make patient experience more comfortable and accomplish excellent results. Credentials are very important. What kind of specialty training and experience the periodontist or oral surgeon have. How many implants did they place? Were dental implants part of their training at the university, or they took a few days courses? Don't be afraid to ask the dentist how many implants did they place. What is their specialized experience and training? There are many common misconceptions about dental implants. One of them would be cost, success rate, age. It is only for younger people, and some people think they're too old to have implants. Women that have osteoporosis, the discomfort associated with the surgery, patients wonder how many implants are needed to replace a full denture, and that implants are a more conservative way of treatment, not a more aggressive way. A big misconception is that implants are very costly. I think the costs are very reasonable when compared to partial and bridges, which periodically need to be redone and could also affect adjacent teeth. Another common misconception is the success rate. Many people believe that implants are experimental, which is not true. This was in the past. The success rate of dental implants is now very high at 96-98%, the highest of any surgery on the human body. This is due to more advanced and improved surgical techniques and newer implant technology that have been improved over the past 15 years. One common misconception is that women that have osteoporosis cannot have dental implants. This is not true. Women who have osteoporosis and have missing teeth are susceptible to jaw fracture due to bone loss. This can be prevented by placing a dental implant. The dental implants preserve the bone and increase the bone density. Many studies have shown that dental implants function similar to a natural tooth regarding maintaining bone density. A big part of my practice is rebuilding the bone for those patients who do not have the bone required in order to place a dental implant. Many patients are concerned about the discomfort associated with the surgery, and they're afraid of pain. Today, you can have your dental implants accomplished while you're asleep, totally relaxed, absolutely comfortable, and in fewer appointments. There is very little discomfort the next couple of days following the surgery. Anyone that is considering dental implants, I invite them to call and find out how affordable dental implants really are. As few as 2 implants can improve a lower denture and strengthen its ability to function with less movement. 4 to 6 implants can dramatically improve the retention of a lower denture and minimize movement when eating. With 6 to 8 implants, one can eliminate the need for removable denture. These implants can be connected with bridges that are fixed and non-removable. Age is a common misconception that it's only for younger people and some people that are older that they shouldn't have implants. Implants can benefit people of any age. While health history has a bearing on a person's suitability for dental implants, age by itself doesn't disqualify anyone from dental implants. Some patients insist that they are too old for dental implants. Patients need to be reminded that they are never too old to enjoy life to the fullest. Age should not be a factor because people today live much longer. I placed implants in 90-year-olds. I've placed implants in 9-year-olds. Some retired people live their golden years of their lives in misery because of lost teeth and loose-fitting denture and their inability to chew or eat the type of food they want. I wish there would have been a way for patients to try the implants, because if once they tried, they would never want to have dentures. When you're missing a tooth, there are a few options of treating that. You can have a bridge or a partial or an implant. The implant is the only option that has the advantage that you leave the adjacent teeth intact. You don't have to touch them. In order to place a bridge, you have to grind the adjacent teeth, the neighboring teeth, in order to put the bridge or to connect the partial. While when you deal with a dental implant, then you don't have to grind out the adjacent teeth. You leave them alone. Perfectly healthy teeth many times are ground down in order to put a bridge. While with the dental implants, you don't have to do that. You can leave the adjacent teeth. They're healthy and natural and not have to touch them, and you just deal with the implant with it for the tooth that it's missing. When you lose your teeth, then you end up losing bone, and bone resorbs very fast. And then it can affect your appearance because that can cause that saggy look. Now, when you have dental implants that preserve the bone and prevents the appearance of premature aging.